ABACUS is a Phase II study looking at 2 cycles of neoadjuvant atezolizumab prior to cystectomy in potentially operable urothelial bladder cancer. We enrolled 96 patients, and we now have the final updated cohort, which we haven't presented previously. This cohort of patients showed actually this consistent response rate continues, with response rates in the high, complete response rates pathologically in the high 30%. That's really encouraging because remember that chemotherapy only achieves a similar response rates, and 4 cycles of chemotherapy over 12 weeks or 2 cycles of atezolizumab over 6 weeks, I thought the chemotherapy would have much higher response rates. So it's showing that the immune checkpoint inhibitors are really active earlier in the disease process. And so that's my interpretation of the ABACUS top line results, and I think that's reinforced by the PURE1 pembrolizumab data. And I think what that's telling us is it may be the best place for immune checkpoint inhibition is in this perioperative space. The second piece that we've done with ABACUS recently is we've done the molecular analysis. So we've done RNA sequencing and immunohistochemistry on the samples before and after therapy. We can show PD-L1 expression going up. We can show CD8 expression going up. We can also see FAP expression, fibroblast expression going up, particularly in the responders. And this may turn out to be a mechanism of resistance. You may remember from some of our stories with TGF-beta and EMT that mechanisms of resistance to immune therapy are not necessarily all directly immune related. So just having low PD-L1 or immune deserts doesn't necessarily confer resistance, and it may be upregulation of other parameters such as fibroblasts that can inhibit immune activation may actually be important in resistance, and we're showing that in ABACUS as well. So we're showing dynamic changes to those. And then from an RNA perspective, we're also pulling together results that are beginning to show that we can show dynamic changes associated with therapy, not only associated with treatment, but also to the dynamic population of cells, because as we treat patients, the cell population seems to change. And that may be easier to manipulate with immune therapy in the future.